So this morning we spent time exploring some of the symptoms, especially those that have the most burden or most impact on your daily lives. And this afternoon we're going to switch gears and talk a little bit about approaches to treatment that you've tried, how well that's various approaches have worked for you or maybe not worked for you, as well as some of the downsides of those treatments or approaches to managing lupus that you've tried. We also are going to explore a little bit with you some of what you'd like to see from future treatment, short of a cure. And to kick off our discussion on this topic, this second topic, we have another panel for you. We have Lorenzo Hall, Donna Wood, Diane Thomas, Kevin Johnson, Elizabeth Santa Cruz, and Addie Badaquin. They're going to share their personal experiences with approaches to treatment. And I'll go ahead and hand it off to Lorenzo to start us off.
Hi, guys. Hello, my name is Lorenzo Hall, and I'm a dancer and choreographer from the city of San Antonio, born and raised, where I'm a senior at the University of Texas at San Antonio. Since being diagnosed with lupus officially in 2013, I've had to change everything about how I was living my life. I was a sophomore at UTSA when I was first diagnosed, and I lived a pretty normal life as a college student before I was diagnosed, and that's when everything changed. I was just really concerned on finding a treatment method that would work, being that when I was first diagnosed with lupus, I had all types of rashes and symptoms that needed to be taken care of, like edema from steroids and severe weight gain, and then chronic urticaria or hives was one of my biggest problems when I was first diagnosed. So coming up with a treatment plan in the beginning was a bit difficult. I was on a lot of steroids and H2 blockers just to get rid of the skin rashes. After many specialists, I found a rheumatologist where my treatment plan wasn't overwhelming as far as medication or side effects. My current treatment plan consists of a rheumatologist, a couple specialists, and my family practice doctor. They all work together to make sure that I'm healthy and on the right track. I take about 8 prescription medications three times a day. The one that is specifically for lupus is Plaquenil. I know we all know Plaquenil. But I have to take a lot of other medications to curb the other symptoms or side effects from the disorder. With like the hives and depression and anxiety, I have medications that I take specifically just for those that aren't the best. A couple of months after my lupus diagnosis, I was diagnosed with celiac disease, or a severe gluten intolerance, low vitamin D, and B12. So exercise plays a huge part in my lupus and maintaining it. I can't eat certain foods I know will trigger a flare-up, like gluten or the inflammation that red meat causes of those things, I'm still new to lupus, and so I would love to find a better treatment to maintain my lupus. And I feel because I was diagnosed so young, and I have a full life ahead of me, that there will be better treatment options to come in the future. The only significant downfall is knowing that not all of the medicines are guaranteed to work. And what this means is, you guys know you can take all of your prescription medicines, some vitamins, eat some fruit, take 2 naps a day, and still be like, something is not right. So, and lupus is just a very temperamental disease, and I have to limit myself as far as sun exposure, and it just really varies from day to day. Currently, I'm finishing up my bachelor's degree at UTSA. Whoop, whoop. And due to lupus, it has taken me longer to obtain my degree, but now I'm registered with Student Disability Services, and they take great care of students with disabilities. So I'm definitely graduating in the spring. Having lupus and me being active as a dancer is one of my biggest passions. Dance is really therapeutic. It helps me physically and mentally, so I guess it is a part of my treatment plan as well. Since being diagnosed, I've just felt extremely responsible and just pressure to raise awareness on what lupus is. About earlier in the year, I released a documentary titled Ascension. And Ascension is a documentary that follows me in my journey with lupus, being a dancer, and the struggles that could be with the joint pain and all the things that comes with having lupus. Also, the field services director of the Lupus Foundation of America Lone Star chapter helped me with the project, so it was a great project. And if you guys would like to follow it, please visit facebook.com/RenTheArts. That's RenTheArts. So the biggest thing I look for when I'm finding a treatment plan is if it's a new medication, how is it going? Is it going to better my symptoms or give me more side effects? You know, that's, you know, the double-edged sword when it comes to getting a new medication. I can have medication that prevents me, I can't have a medication that prevents me from really living my life to the fullest. It's really difficult at times to distinguish a new symptom or a new side effect. So when thinking about future treatments, an ultimate goal as far as a drug for lupus, I really look forward to the one day where we could maybe have one base drug that treats the autoimmune disorder and just an overall drug, you know, with maybe a couple vitamins, and that will be it. And I really thank you guys for hearing my story, and I look forward to a world with no lupus.
My name is Donna Wood. I appreciate this opportunity of being here and speaking with you. I have been living with systemic lupus and subacute cutaneous lupus for the last 15 years. Living with lupus is indeed a challenge. Symptoms can change not only from day to day, but even hour by hour. Currently, I try to manage my condition by strictly following my medications as prescribed by both my rheumatologist and a dermatologist who specializes in autoimmune disorders. Getting the right combination of medications to work was a long journey. The first time I was hospitalized, a small rash developed into a total body rash of acute cutaneous lupus. I looked and felt like a burn victim. I have pictures, but I'm charging to see that if you want to see them. Solumedrol IV pulse treatments and a morphine pump helped alleviate some of the discomfort. I went home on high doses of oral Medrol, Imuran, Dapsone, Oxycontin, steroid cream, and an increased dose of Plaquenil. The rash was resistant to Imuran and Dapsone. Arava didn't seem to help much, and when I was on Cellcept, I literally felt like I was dying. At this point, I was approved to try thalidomide, which I was really not wanting to do. I opted for some more outpatient Solumedrol IV treatments, which, along with oral high doses of Medrol, eventually caused bone loss. I experienced 2 fractured vertebrae and a fractured sternum in the space of 6 months. To combat this, I was put on Actonol. A move to another state and a new doctor who was determined to lower my Medrol dose had me on cyclosporin along with specially compounded quinaquine. These turned me quite jaundiced looking. At this point, the lupus lesions were still numerous, but the burning skin sensation was starting to lessen. I had a couple of IVIG treatments to see if they would help, but because of the side effects of severe nausea and migraine headache following each treatment, my doctor and I decided to discontinue them. About 5 years ago, a combination of medications was found to help me. Presently, I'm taking Plaquenil, 200 milligrams, 20 milligrams of methotrexate orally once a week, folic acid 2 milligrams on the days not taking methotrexate to manage the side effects from same, and 5 milligrams of prednisone daily. 2 years ago, I was diagnosed with rheumatoid arthritis. So I have what my doctor calls Rupus. First time I'd ever heard that. My medications now include an Enbrel auto-inject pen on a weekly schedule. I avoid the sun more than Dracula. Heat along with sun can also trigger headache, nausea, and skin lesions. I'm never fully dressed without a full coat of sunscreen, and my car windows are tinted as dark as legally possible. And I've been stopped a few times, and then they find out it's a granny. As well as avoiding UV light, I try to avoid stress and becoming overly tired. I have what I term a short shelf life. A few hours of tending grandchildren usually means a payday the next day, requiring a long sleep in or a total day of rest. The downside to my current medications are those side effects. Sometimes the day after methotrexate, I might just feel a little more fatigued than usual. But other times, I'll wake up feeling like, what bus hit me in the night? Extreme fatigue, body aches, and nausea are not unusual. Prednisone has the unwanted side effects of weight gain along with thinning bones and skin. And while on Plaquenil, I became famous at the University of Utah Hospital as I was one of the rare percentage where the medication settled into my tissues, leaving me with bluish-green arms and legs. Now that I'm on a lower dose, my discoloration is much less. Since hair loss, body aches, fatigue, and nausea can all be symptoms associated with lupus, it is very often hard to know what is a medication side effect and what is that damn disease. Therefore, an ideal treatment needs to treat the disease with very minimal side effects. I would be the first to stand in line if something were found that would allow me to function with the energy and confidence that I had before lupus. I would love to be able to commit to planning and doing things without the worry of, sure hope I can do this, and not fearing of having to cancel out. Because lupus manifests so differently for every individual affected, finding that ideal treatment is a challenge. Wouldn't it be wonderful if a medication or a treatment were found to negate the UV light rays, as most of us are so sensitive to these? With the progress in research and the development of new biologics beginning to be tailored to individuals and specific conditions, I am hopeful that in the near future we will see advanced treatments for not only lupus, but all autoimmune disorders. To those pursuing this endeavor, I say thank you. Keep on working on it. And as the sign on my fridge says in large capital letters, DLLW. Don't let lupus win.
Good afternoon. I am Diane Thomas from Chicago, Illinois, and I was diagnosed with lupus about 14 years ago. And originally, the diagnosis didn't mean much to me. My rheumatologist started me on prednisone that I stopped after a couple of weeks on my own because it caused my vision to blur, it increased my weight, made me feel jittery, and gave me insomnia. She and I didn't see eye to eye on treatment, and I was basically left untreated for 7 years. July 1st of 2010, lupus decided to really kick in, and I had a cardiac arrest. I was resuscitated twice, placed on hypothermia, woke up on dialysis with a defibrillator inserted to make sure that my heart would not stop beating again. So during that time, I've had kidney failure, respiratory failure, sepsis, bowel obstructions, had colostomy placed and reversed. So lupus has attacked many of my vital organs, and I was being treated for symptoms and conditions as they appeared, which made it very hard for me, especially since lupus can attack any organ or system in your body without warning. Right now I have a medical team that consists of an internist, a rheumatologist, a cardiologist, a nephrologist, and a gastroenterologist. And I'm truly blessed to say that they work very hard to keep me in remission. So remission for me means waking up approximately 2 hours before I need to, even though I work 10 minutes from my home. I use the additional time to stretch and to give myself, a pep talk to see if I actually feel well enough to get up to go to work and perform the duties on that day. Normally I can push through and I'm able to do what I need to do, but on the worst days is when the Raynaud's kicks in and I can't feel my fingers or toes, can't do the buttons, can't brush my teeth. So you just literally have to stay in bed all day until it passes. If it were not for my medical team, my family, and my church home, I truly would not be sitting here today being able to share my experiences with you guys. I've started to limit my activities with others because you need to walk slower or be dropped off at the door. And it's hard sometimes for people to correlate how you look with how you feel. So currently, I'm on several different medications. I've gone through several different things. I've been on dialysis, as I said. I went through chemotherapy, so I go to dialysis from 5 to 10 in the morning and then to chemotherapy. I've been started on Cellcept, Plaquenil, of course, the deadly prednisone, multiple narcotic pain medications just to be able to make it through the day. I have a friend that was diagnosed with lupus recently, and I remember feeling really sad for her because she didn't know exactly what to expect. So I asked God to give me her pain because I could deal with it until she figured out what she had to face. An ideal treatment for me would be to limit the amount of pills that we need to take each day, slow the progression of the disease, and decrease the side effects. With lupus, it's difficult to tell if you're feeling the way you do because of the disease or because of the medication. I'm optimistic and I remain prayerful that new and improved treatments are coming that will not only benefit all of us here today sharing our stories, but for those who will be diagnosed in the future. Thank you.
Good afternoon. Thank you to the organizers and all the participants at this Lupus PFDD meeting. It's encouraging to know that our experiences and voices can make a difference. My name is Kevin Johnson, and to put my perspective in some context, since my diagnosis with systemic lupus, I earned both a bachelor's and PhD in chemistry, and I'm currently a chemistry professor at a small undergraduate college outside of Portland, Oregon. I'm also a husband and a father to 2 sons. I've had lupus 36 years. The stories of lupus you have heard today and its devastating consequences to a normal life are all too familiar to me. I can best summarize my current drug treatment regime by briefly looking back on how I came to where I am today. I was a sophomore in college when I developed increasingly debilitating arthritis symptoms. And after 5 months and just 1 day in the sun, I was diagnosed with lupus when I experienced my first lupus flare, which brought a high fever, nausea, and a butterfly rash on my face. At the time, my rheumatologist explained that kidney disease was a risk with lupus, but unfortunately, it hadn't affected me at that point. I was treated with high-dose prednisone, tapered over the next month or so to a lower maintenance dose. And I also continued taking naproxen for my arthritis. I started taking Plaquenil, but immediately developed an allergy to the drug, which has limited treatment options for me ever since. Additionally, my doctor advised me always to wear sunscreen when outdoors in the sun. This latter advice has held its value to me to this day, allowing me to remain active outdoors. My next flare came 4 years later after graduation. This time, along with the fever, my new symptoms were a full-body rash and pericarditis, the latter causing me occasional debilitating chest pain. My new physician prescribed azathioprine. The flare was again controlled with high-dose prednisone until the symptoms abated, and I was able to taper my prednisone dose. It was only a little more than a year later, while I was in graduate school, that I suffered my third flare. My symptoms were similar, high fever and pericarditis. My third rheumatologist also treated me with high-dose prednisone, but he had me taper too quickly, and the symptoms returned, this time even worse. My pericarditis became quite severe. This doctor did not aggressively treat my pericarditis and spoke of it as more of a nuisance pain with no long-term consequences. Additionally, when the flare recurred, I developed a blood clot in my right leg. It was only after this DVT did my doctor test my blood for anticardiolipin antibodies, which would have predicted a risk for blood clots. I was treated with Coumadin for a short time, and after discontinuing it, I developed again a DVT and was treated with blood thinners. Ultimately, I did not want to be on blood thinners long term, and after my recovery from the second DVT, at the doctor's suggestion, I began daily aspirin therapy. And so at that time, my treatment was prednisone, naproxen, azathioprine, and aspirin. I also made sure to eat well and get regular exercise. At any sign of increased symptoms, I would increase my prednisone dose for a week or so. I was stable on this regime for about 12 years. During this time, I developed osteoporosis from the long-term prednisone use, suffering compression fractures in my spine and cracked ribs. I started taking Fosamax shortly after it became available and continued taking it for almost 20 years, well beyond what I now know is the 5-year recommended length of treatment. Fortunately, I've had no recent fractures, and I'm not taking medication for osteoporosis at this time. About 18 years ago, I developed lupus nephritis. I was treated with IV cyclophosphamide for about a year. Following that treatment, I stopped taking azathioprine and started taking mycophenolate. My kidney function has returned to normal with no remaining signs of inflammation, and since then I've had no major flares. My pericarditis is mostly absent, and when it recurs, I control it with short-term increase in naproxen. Unfortunately, years of pericarditis has caused scarring of my heart, which is the root cause of several episodes of atrial fibrillation, which fortunately have always resolved, returning to a normal heartbeat. The aspect of my disease which has not been well controlled is arthritis, beginning when I stopped azathioprine. Contrary to my first lupus doctor's explanation, the arthritis has caused substantial damage to the joints in my hands and feet. 5 surgeries later, I am still suffering from that. In the past 2 years, I've tried controlling the arthritis with methotrexate, leflunomide, and again adding back azathioprine. None of these treatments has been effective. I'm still seeking a better means to control my arthritis symptoms. At my current doctor's suggestion, I considered but ultimately rejected the biological treatments, IV treatments of Rituxan and Benlysta. I'm at this point not willing to take the risk of lasting increased susceptibility to infections, especially given my current situation where work and personal life put me in daily close contact with many individuals. And I remain unconvinced that these treatments will maintain the control over my lupus nephritis, something I'm not willing to risk. I read advertisements for drugs targeting arthritis symptoms in rheumatoid arthritis and hope that there will soon be similar options available for lupus patients with arthritis. Today, I learned that only one of my therapies is FDA approved for lupus. As a scientist, I challenge the FDA and drug developers to continue the work of today and develop a means to collect meaningful data that differentiates the manifestations of lupus and the individual patients that experience these, and correlate the individual outcomes of the diverse drug and lifestyle approaches to treating lupus. My request to drug developers is to better recognize individual differences in lupus patient symptoms and seek treatments that address the active disease in individuals, perhaps combining multiple drugs rather than relying on treatments that broadly suppress immune function. Thank you.
Good afternoon. My name is Elizabeth Santa Cruz from Kearney, New Jersey, and I'm the mother of 2 beautiful children. My daughter Mia is 10 years old, and she was diagnosed with lupus last year, just a few months before her birthday. It took 2 years to get her diagnosis. Since her diagnosis, Mia was prescribed Plaquenil, an anti-malarial drug that was approved in 1955 as a medication to treat lupus. 1955. Plaquenil may improve joint pain, skin rashes, but it's not sufficient treatment for other severe lupus symptoms, and it can take up to 6 months to see the full benefits. Plaquenil did help with the mouth ulcers, fingernail issues, but in her case, it doesn't help with the joint pain, fatigue, rash, protein in the urine, or lupus fog. Plaquenil is a pill. How do you explain to your child that she needs to take a pill on a daily basis when all her previous medications were liquid? Like many lupus patients, Mia needs to go for blood work every 3 months. This is important because it can help assess how the internal organs are functioning. Mia never liked going for blood work, even when it was once a year. There has been many occasions that Mia was about to faint. They had to put ice on her back to ensure that didn't happen. It is not easy seeing your daughter get nervous and start crying, especially when you know that this is such an important aspect. Within a year of diagnosis, Mia has seen a pediatric rheumatologist that oversees her care, pediatric dermatologist due to her skin rash, retina specialist because she's taking Plaquenil, and an eye exam is recommended. She has seen a pediatric hematologist due to a clotting abnormality, pediatric neurologist, pediatric nephrologist due to protein in the urine, and a physical therapist due to joint pain. In addition, a 504 plan was put in place at her school to address the new necessities. As you can see, my daughter needs a wide range of a specialist to ensure that her basic care needs are met. Plaquenil doesn't help with lupus fatigue or extreme fatigue, which is a common and very debilitating symptom of lupus and for which is no good treatment. As a parent, I feel impotent when my daughter tells me that she is so tired that she can't even move. The weather plays an important role and factor with people diagnosed with lupus. The humidity makes her extremely tired to a point that she's not able to function. I'm never gonna forget the first time that I had to help my daughter change into her PJs because she didn't have the strength to do it. Many modifications were made at her school to address this symptom, including adding air conditioner to her classroom. Joint pain was a surprise to us. I never expected my daughter to have this symptom. There was a point that Mia was not able to walk more than 40 minutes due to joint pain. Literally, she was not able to walk. During one of her karate classes, her knee got locked. She was limping. We were concerned. What now? What does this mean for her? What can we do to help her? Thankfully, her new rheumatologist was very proactive. And after eliminating that the pain was not due to arthritis, she sent her to physical therapy. For many, many, many months, my husband took Mia to her physical therapy appointments in the mornings, just before school. In March this year, we were at the mall, and Mia said that she wanted to walk more. We said, okay. We looked at each other. We were nervous. We kept looking at her facial expressions for signals and clues. That day, Mia was able to walk for more than 2 hours. As a parent, that is such a milestone. It is as valuable and precious as her baby steps. At this age, Mia, like any other kid, should be independent with a basic task. But instead, because of lupus, I have helped my daughter take a shower, get dressed, because she was in so much pain that she was not able to do it on her own. Creating new treatments for this will give her back and many a sense of independence. Because Plaquenil was not created for lupus, this means that other approaches need to be added. As a mom, I want my daughter to have as much of a normal life as possible, and this will happen in new treatments address these symptoms. Mia is a very happy child. She's learning at an early age to have a voice. She always has a smile on her face. Lupus is an autoimmune illness that forces you to change your lifestyle. We need new treatments for these debilitating symptoms for my daughter, for these children affected by this illness, for every single lupus warrior affected by this disease. Thank you.
Good afternoon. My name is Addie Badaquin. I'm 30 years old and I'm from Seattle, Washington. I'm very gracious to have this opportunity today to speak in front of you all in the hopes that this may lead to lasting and positive efforts for the lupus community. I was diagnosed after being admitted from the ER when I was 19. My symptoms included a high-grade fever, a swollen face, and swollen ankles. My symptoms came on very quickly, starting with my ankles just a couple of months before I was rushed to the ER. After several labs and tests during my hospital stay, including a kidney biopsy, I was officially diagnosed with lupus nephritis. After I left the hospital, I immediately started on oral therapy to treat my lupus, which was a combination of Cellcept, prednisone, lisinopril, and furosemide, to name a few. My previous symptoms of severe edema, anemia, and fevers remained, along with new symptoms such as extreme fatigue and muscle weakness. I was almost in worse shape than I was when I was in the hospital. I even developed cellulitis, which became very painful and annoying to treat. All of this contributed to my need of a blood transfusion and platelet transfusion. It was then decided that the most effective form of treatment for me would be chemotherapy. I began IV therapy of Cytoxan about 2 months after my diagnosis and for a duration of 6 months. This therapy quickly turned things around for me in terms of energy and gaining my independence back, but I would later learn that it was a fleeting solution. Throughout my disease's progression over the past 11 years, I have been through several different forms of treatment, mostly IV therapy, toggling back and forth between Cytoxan and rituximab. I would experience the same symptoms, and relative only to my kidneys. This was proven through 2 more kidney biopsies I would have in my life. There were chunks of time where I felt like my lupus was inactive, but I was still on maintenance medications, and I've never made it to full remission. A flare-up for me usually includes a high-grade fever, increased edema in my lower extremities, and a high creatinine reading. At its very worst, experiencing these symptoms all at once can have a negative impact in the most life-disrupting ways. The edema can become so heavy and painful that it can prevent me from walking without assistance, as well as driving or bathing without assistance. It can also affect the shape of my body, which means I can only wear certain footwear or clothing. All of this affects my abilities to remain high-functioning in my full-time job and day-to-day routine. On my best days, I have enough energy and am able-bodied enough to do what an average person is able to do, like work a full day, exercise, and cook a meal. I know flare-ups are different for everyone, but for me, it could mean a total disruption in my lifestyle. The best regimen that is keeping my flare-ups at bay is the IV therapy of rituximab every 4 to 6 months, along with medications to support this, including prednisone, 3 blood pressure medications, an antibiotic, and Fosamax to prevent osteoporosis. However, the biopsies have proven long-term kidney damage, and I have still not achieved remission. Long-term use of IV therapy was never mine or my doctor's solution for my lupus. The only real solution was getting a kidney transplant. I was recently approved for a transplant after a thorough evaluation with the University of Washington's panel of nephrologists and their care team. How my disease was progressing at my age and the lack of positive strides I was making in beating down my lupus was what made me a good candidate for a transplant. I hope that after I receive one, I can lead a healthier, more peaceful lifestyle. In my personal experience having lupus, with a life-threatening organ involved, I am not sure what future therapies I could benefit from, aside from a transplant. I think in my case, it was the more aggressive the treatment, the better, but it didn't mean that it was the best solution for me. If the process of getting approved for a transplant could be done sooner in diagnosis, and there were therapies that could maintain kidney health in the interim, the combination of the two could make a real difference in someone's life. It took 11 years of trial and error therapy to finally decide on a transplant, and because of my blood type, it could mean another 6 years for me until I actually received the transplant. If there were faster solutions for lupus patients like me, it would mean that we could move on and focus on other parts of our lives. Everything I've been through with this disease has caused so much worry and anxiety that some days I can't help but focus on it. But knowing my abilities and limitations and setting healthy boundaries for myself helps me lead an enjoyable life. It's challenging to do, but when I have good days, I try to remember those moments and be thankful for what I have. Moments like today give me hope for the future. Thank you.